I'm Dr. Mira Irons, President and CEO of the College of Physicians of Philadelphia. Welcome to the latest in our series, College Conversations, Medicine, Science, and Society. Today, I'm speaking with Dr. Natalia Ortiz-Torrent. Dr. Ortiz-Torrent is a professor of clinical psychiatry and behavioral science at the Lewis Katz School of Medicine at Temple University and medical director of consultation and liaison psychiatry at Temple University Hospital. Dr. Ortiz-Torrent has been a fellow of the college since 2015 and a member of the College Board of Trustees since 2021. Welcome, Dr. Ortiz-Torrent.
Thank you, Dr. Irons. Thank you for the invitation.
Thank you for doing this for us. Can you first start maybe by talking about your educational and professional journey in medicine? I know that you grew up in Puerto Rico. Can you tell us how you decided on medicine as a career, where you went to medical school, and how you decided on psychiatry for your specialty?
Yeah, of course. So I decided to study medicine because I wanted to take care of the people, of patients. I decided to be a psychiatrist as a third year medical student after I rotated through all the specialties. I pretty much like everything. But psychiatry was the specialty in which I felt that I connected the most with the patients. I was able to understand the human experience, how they live with their medical conditions, and I had more time to learn from them. So I felt more comfortable. A little bit of background, I come from Latin American family in Puerto Rico, town called Calle, small town, 40,000 people. My father was a business owner, so we, grew up in the business. But my father, even though he came from, Latino culture, and he was actually on the older side, he would have been now 102 years.
Uh-huh.
And my mom is 87 now. So we come from different eras. And even though he was a very traditional person, he told me since very young, I want you to have a career, I want you to go to college, and I want you to be a physician. Yes, some people, don't like to be told what to do. And, I probably went through a little bit of that phase. So before I became a physician, I decided to study chemistry. The reason why I studied chemistry was because during that time, there were only a few medical schools in Puerto Rico, and it was a challenge to get through them. There was a lot of people applying and not a lot of spots, really. Classes were 60, each one of them. So I said, okay, my mom helped me with this, mentored me with this, and she said, it would be a good idea that you have a career before. And I learned about chemistry, fell in love with that career. And I said, if I don't make it to the School of Medicine for any reason, I will be a licensed chemist, work, and then apply again. That was the plan. How did I decide to study psychiatry? It was through when I did my rotation as a third year medical student.
Okay, great. You were the first Hispanic Latinx president of the Philadelphia County Medical Society. What does that mean to you?
It was such an honor. I see myself like a little bit of, even though at a younger age, having this role, but for some reason, I saw myself going through a lot of challenges, when I moved from Puerto Rico to the mainland. So I became a little bit of an advocate for the disadvantaged in the community, specifically in the Latinx, Hispanic, Spanish speaker community. Through that process of different, leadership positions, mostly collaborating with the community, having this opportunity of bridging, moving from collaborating with the community, learning from the Latino community, getting the opportunity to serve in a board, embracing diversity, learning with people who had years of experience in organized medicine, which is something that I'm very interested, as well as public health policy is something that really attracted me. And then learning through, the process and getting mentored through people that I didn't know, and they were different than me, I was different, and they actually embraced, my diversity. And then grow into that process and getting through the, let's say, the imposter syndrome. When I was nominated, I said, how come you nominated me? I can't believe it. And they believe in me. And I obviously asked, for mentorship. And, it was such an honor to celebrate that breaking of the glass.
Great. Absolutely, absolutely. You know, you're also very active in volunteer work and philanthropic efforts and have served as president of the Society of Ibero Latin American Medical Professionals, which has a more of a community focus, I think. Can you tell us about the work of that organization?
Yes, so we are a group of healthcare professionals with the interest in Latin American Hispanic community. So we address public health issues that affect the community. Most of the healthcare professionals are Latin American Hispanic background, but not necessarily. You know, we have people that are really invested in helping the community and want to learn more or already know about the community. So what we do, several things. We have the Dr. Carlos Finlay conference in which we discuss public health issues. The most recent was effective response on the veterans' suicide crisis. And we have people from the government, nonprofits, veterans, healthcare professionals, all together, sat down at different round tables and discussed the crisis and came up with recommendations. That was quite fun. Then the other thing that we do, we serve in healthcare fairs within the community. We also provide a mentorship or sponsorship from mostly to the healthcare professionals involved, but also we serve as a bridge within the community. Like, let's say, the students that are interested in pursuing a career in healthcare. For example, we collaborate with Esperanza High School, middle school, and we attend to a program that they have. The same thing with Concilio. And we talk about our careers and what's the pathway to get into our careers. We also help other groups, like, for example, Latin American Medical Student Association, to reach out those communities or those students that want to learn more about the process of how to become a physician, how to apply to college. The other thing that we do is we provide scholarships.
Mhm. Wonderful. You know, I've heard that you share my passion for guiding the next generation of physicians. Can you tell me more about how you work with medical students and those interested in a career in medicine? You've talked a little about it on that last question also, but, you know, more specifically, how can we encourage and support more Hispanic Latinx students to pursue careers in medicine? And, you know, if you have any thoughts, how can the college help also?
Yeah, I think you had the excellent program on the junior fellows. So I think what happens is that the community, like the schools, the school counselors, don't get to know this information about the programs that are out there. I know this from, talking to the leaders in the community, some of the students, some of the parents, they don't know about all, the great things that are happening. So what we do is we get together and we're a network. Also, we have people from the community that, help us to learn and provide the wisdom of where the need is wanted, where the students are, or where the, community needs help. So, but I think with the college, what we should do is to go to those schools to do the presentation about the program so the students know when to apply and what it entails. The other struggle that I have found in the community is when you offer to the students an opportunity to open a pathway towards a career, there's a challenge because some of the students have the talents or the talent can be built. They struggle with what we call the social determinants of health. They had to make a decision. I have the opportunity to do something during the summer, but I had to provide for my family because my parents are struggling. And it's my role to help and provide not 100%, but to contribute to the family. So they prefer to attend if it's going to be a paid opportunity, because what I have found, the parent will ask, how much are they going to pay you? And that's some of the challenges. And I have some of my colleagues that struggle with that when they, were growing up and the parents would tell you have to provide for the family. You should not maybe go to college, or you go to college, how are you going to fund it? Not for all the Latin American, not for all the Hispanic. In a way, I was privileged, but canvassing the community, this is what at times you encounter. Kids that want to succeed, but they struggle between the responsibility within the family and what they would like to do. So it's about educating the parents too.
Yeah, yeah. So, just shifting a little to some of the work that you're doing in your specialty, much of your work focuses on the interface between how the brain, mind, spirit, culture, and psychology interact amongst each other. How do you think physicians can better integrate this interface into the care of their patients?
Thank you for asking that question. In the field of what we call consultation and liaison psychiatry, we are trying to have a holistic approach to the human being, how a medical condition will affect the patient psychologically, and how that effect can potentially affect the patient's medical condition. A classic example, and we're talking about in Latin America, there's a high incidence of diabetes. It's a very challenging, chronic condition. So you have a patient diagnosed with diabetes who has to make a lot of adjustments in the diet. And Latin America, the diet has a lot of carbohydrates. And it's very delicious. So, and your parents, I don't know in other cultures, but in our culture is sometimes love comes in the way of like food.
Exactly.
So this is a small example of the struggles that sometimes people with diabetes can have. They had to make adjustments, they had to accept the disease, they had to make a psychological adjustment, diet adjustment, start medications that are all their life, and the struggle with a lot of control and how that affects your family. So that's an example of some of the work that I do. Other work that I do, all the CL psychiatrists will do, is when we work in the hospitals, we see how medical conditions, like for example, lupus, can present with psychiatric behaviors when the lupus flares. They say we have people that have a flare of lupus and they present with depressive symptoms. And the treatment for that depression is the medication for the management of the lupus. They start the medication, they feel better. So we try to explore how those medical conditions manifest as psychiatric disorder.
Mm-hmm. It's interesting listening to you talk about the cultural issues that come up during medical care. We need to diversify the healthcare workforce. And it's a great example of understanding how the culture affects food in a person's life in terms of targeting their medical care, understanding that as part of their medical practice. That would be an example of having a physician or a healthcare provider from the same culture, wouldn't it?
Yes, it's about being curious and understanding. That I had to learn through my career, and it's fascinating, also how to be curious and try to understand the other cultures, which is a very humbling experience. So I asked my patients, you said that slang, can you explain that to me? And I have some excuse, because they all know that I'm not from the mainland, but they like it, they like it in a way to teach me, more about their culture, which is so interesting to learn how people interpret their health experiences within the lens of their life experiences, their culture, their spiritual beliefs, all of that history. So it's fascinating.
Yeah, absolutely. I read an article where you stated that there was never, and this is a quote, been such a time that the differences in healthcare outcomes between ethnic groups have been so noticeable than during this area of COVID-19. How can physicians, who are caring for patients, work toward changing these differences? And do you see a role that the college can play in this important work? I think we all know that these differences exist. Do you have any suggestions on how individual physicians can help do this?
Let's say a little bit of background, how I learned about this. Obviously learned about this from my work in a ordinary, hospital, working with people that social determinants of health. But I also joined, through SILAMP, we did want to educate people about COVID-19. We facilitated some sessions, partnering with a nonprofit that has the roots within the community. and it knows the community well, has the trust, because the trust is an issue, the trust of the community, and having that, nonprofit or grassroots, for example, group, introducing the healthcare professional, if it comes from the College of Physicians, and do a session of healthcare education. It should be a small group because people don't feel comfortable, speaking up. We have a session with the infectious disease physician who spoke Spanish, and we have a mental health professionals that had a lot of questions about the vaccines. So at the beginning, they all listened to what they had to say. Then we wanted to have some questions from the people. So what we did is we gave some examples of things that we saw, concerns that people had in general. We normalized them, so people didn't feel that they were strange. And then we invited them. We said, this is, let's say, a visit to the doctor in this case. This is a visit to the doctor. This is your doctor. This is private. Ask any questions that you have right now about the vaccines. And we'll talk about that. And you'll be surprised how many questions people had that they felt very uncomfortable asking. So I think, having that partnership with people that the community trusts and the College of Physicians being invited and introduced by that group to the community, that'll be a great strategy to do, for example, healthcare education, introduction to the programs to help the youth, and the career mentorship programs that the college has.
Okay, great. So, you've been very kind with your time today. Any final words? I always give people an opportunity to give a final thought.
Well, I just want to tell thank you to the community of the College of Physicians for the opportunity, for your interest in helping the people that are disadvantaged, and for opening the doors to the diversity, to helping us to have a voice and represent our community. So I really appreciate this opportunity.
Oh, and thank you also. Thank you so much for taking the time to talk to us today. And thanks to all of you for listening. We'll be back again with another episode of College Conversations, Medicine, Science, and Society soon. Thank you.